Your morning medications could be quietly stealing your memories. At this very moment, millions of seniors are taking drugs prescribed by their doctors to help manage everyday conditions. But recent scientific research has revealed a deeply troubling link between some of the most commonly prescribed medications and rapid cognitive decline. These aren't rare or experimental drugs. We're talking about medications sitting in medicine cabinets all across America, trusted by both patients and physicians. Yet studies published in leading medical journals show these drugs may be accelerating dementia at an alarming rate. One class of medication was shown to increase dementia risk by an astonishing 54% after just 3 years of use. Another long-term study followed more than 3,000 seniors for 7 years and found that certain medications caused measurable brain shrinkage on MRI scans. Most shocking of all, the number one drug on our list is prescribed to more than 15 million Americans every single year. A groundbreaking study published in JAMA Internal Medicine found it significantly increased dementia risk within just months of starting treatment. Even the scientists were stunned by what the data revealed. All of the studies and medical research we reference are linked in the description below if you want to explore further after watching. Before we begin, let us know your age and where you're watching from in the comments. We're reading and responding to every comment, so drop yours below. Now, without further delay, let's get started. Number 9. Antihistamines for allergies and sleep. Medication number 9. We'll start with medications many people don't even think of as dangerous because they're available over the counter. First-generation antihistamines like diphenhydramine and chlorpheniramine are found in popular allergy medications and sleep aids that millions of seniors use regularly. These drugs work by blocking histamine receptors in the body, which reduces allergic reactions and causes drowsiness. But they also block a chemical in the brain called acetylcholine. Acetylcholine is a neurotransmitter that plays a vital role in memory formation and learning. When it's blocked repeatedly over months or years, the brain is essentially prevented from performing one of its most important functions. A study published in JAMA Internal Medicine followed 3,434 adults aged 65 and older for more than 7 years. Researchers found that those taking these antihistamines had significantly lower brain volume on MRI scans compared to those who didn't. The hippocampus, the brain's memory center, showed the most severe shrinkage. Even more concerning, participants using these medications performed worse on cognitive tests measuring memory, problem-solving, and planning. The study concluded that regular use of these drugs was comparable to aging the brain an extra 2 to 3 years. Many seniors take these medications nightly for sleep without realizing they're exchanging short-term rest for long-term cognitive damage. The effects are dose-dependent as well. The more you take and the longer you take them, the greater the impact on brain function. Number 8. Proton pump inhibitors for acid reflux. Medication number 8. Proton pump inhibitors, or PPIs, are among the most widely prescribed medications in the world for heartburn and acid reflux. Brand names like omeprazole, lansoprazole, and esomeprazole are household staples, and millions of seniors take them daily, often for years. These drugs work by shutting down the acid-producing pumps in the stomach, relieving that burning sensation. But research has uncovered a disturbing connection between long-term PPI use and dementia. A German study published in JAMA Neurology analyzed health records from more than 73,000 adults aged 75 and older who were dementia-free at the start. After 7 years of follow-up, researchers found that regular PPI users had a 44% higher risk of developing dementia. The underlying mechanism is both fascinating and frightening. Long-term acid suppression interferes with vitamin B12 absorption, which is essential for maintaining the protective coating around brain nerve cells. Without enough B12, nerve cells deteriorate, leading to cognitive decline. PPIs also disrupt the brain's ability to clear amyloid protein. When amyloid builds up, it forms the plaques characteristic of Alzheimer's disease. A study from the University of California, San Diego found that mice given PPIs developed significantly higher amyloid plaque levels after just 3 months, with a 30% increase compared to untreated mice. Number 7. Anticholinergic drugs for overactive bladder. Medication number 7. Nearly 30% of seniors struggle with overactive bladder, and the most commonly prescribed treatments are anticholinergic medications like oxybutynin, tolterodine, and solifenacin. These drugs reduce bladder spasms by blocking acetylcholine receptors in the bladder muscle. But as we mentioned earlier, blocking acetylcholine in the body also blocks it in the brain, where it's essential for memory and cognition. A landmark study from the University of Washington followed 3,434 seniors for more than 10 years, tracking every anticholinergic medication they used. Published in JAMA Internal Medicine, the results were alarming. Seniors who took these bladder medications for more than 3 years had a 54% higher risk of developing dementia. Using the Anticholinergic Cognitive Burden Scale, researchers found that taking just one strong anticholinergic drug daily for 3 years was enough to significantly raise dementia risk. Brain imaging revealed physical changes as well, including gray matter shrinkage in areas responsible for memory and executive function. Even more troubling, research from the University of East Anglia suggests some of this damage may not fully reverse after stopping the medication. Number 6. Benzodiazepines for anxiety and insomnia. Medication number 6. Benzodiazepines such as lorazepam, diazepam, and alprazolam are prescribed to millions of seniors for anxiety, sleep problems, and muscle tension. These drugs enhance the effect of GABA, a neurotransmitter that produces a calming effect. But long-term use has been strongly linked to cognitive decline. A French study published in the British Medical Journal followed 1,796 adults aged 78 and older for 15 years. Participants who used benzodiazepines for more than 3 months had a 51% increased risk of dementia. Long-acting versions posed an even greater risk. A Canadian study comparing nearly 1,800 Alzheimer's patients to 7,200 controls found similar results, with dementia risk rising as duration of use increased. These drugs impair neuroplasticity, the brain's ability to form new connections, and over time this leads to cognitive decline. They also alter neuron structure, with electron microscopy studies showing changes in dendritic spines, where nerve signals are received. Number 5. Tricyclic antidepressants. Medication number 5. Before newer antidepressants were developed, tricyclics like amitriptyline, nortriptyline, and doxepin were widely used. Many seniors still take them today, often for chronic pain or nerve pain rather than depression. These medications have strong anticholinergic effects. A study in the journal Neurology followed 688 adults with an average age of 74 over 10 years. Seniors using tricyclic antidepressants experienced faster cognitive decline than those on newer medications. On average, they scored 4.5 points lower on the mini mental state examination. Brain scans revealed significant volume loss, especially in the temporal lobe, with an average reduction of 8.3%. PET scan research from Indiana University also showed reduced brain glucose metabolism in regions affected early in Alzheimer's disease. Number 4. Certain blood pressure medications. Medication number 4. Not all blood pressure drugs affect cognition equally, but some raise concerns. Beta blockers that cross the blood-brain barrier, such as propranolol and carvedilol, can impact cognitive function. A University of California, Irvine study of 774 seniors found greater cognitive decline among those taking centrally acting beta blockers compared to those using peripheral ones. Cognitive scores dropped by an average of 3.2 points over 3 years. Importantly, other blood pressure medications, like ACE inhibitors and angiotensin receptor blockers, have been shown to reduce dementia risk. A Johns Hopkins study of over 3,000 seniors found 35% less cognitive decline among ACE inhibitor users. Number 3. Opioid pain medications. Medication number 3. Opioids such as oxycodone, hydrocodone, and morphine are frequently prescribed to seniors after surgery or for chronic pain. These drugs block pain signals by binding to opioid receptors in the brain and spinal cord. However, a JAMA internal medicine study following 2,000 seniors for 12 years found a 60% higher dementia risk among regular opioid users. Brain imaging studies from UCSF revealed reduced gray matter volume in critical cognitive regions after just 6 months of use. Opioids also suppress new neuron growth in the hippocampus and trigger inflammatory immune responses in the brain, further damaging neurons. Number 2. Anticholinergic antipsychotics. Medication number 2. Antipsychotic drugs like quetiapine, olanzapine, and risperidone are often prescribed to seniors, including those with dementia-related behavioral symptoms. These medications have strong anticholinergic properties and directly affect dopamine. A BMJ study of over 40,000 dementia patients found a 60% increase in accelerated cognitive decline among those prescribed antipsychotics. A Finnish study of more than 70,000 Alzheimer's patients showed higher mortality rates, with deaths occurring 1.5 years earlier on average. Clinical trials published in The Lancet found cognitive decline progressed 2.5 times faster in patients taking antipsychotics compared to placebo. Number 1. Combined anticholinergic antidepressants and other anticholinergics. Medication number 1. The most dangerous situation isn't a single drug, but the combination of multiple anticholinergic medications. Seniors often receive prescriptions from multiple specialists without coordination, leading to cumulative exposure. A major JAMA internal medicine study tracking 3,434 seniors for 7 years found that those with a high anticholinergic burden had a 54% higher risk of dementia. Even more concerning, the damage appeared permanent. Brain volume loss did not reverse after stopping the medications. Research shows more than 20% of seniors take multiple anticholinergic drugs, often unknowingly. These findings come from large-scale, peer-reviewed studies published in the world's most respected medical journals. Never stop prescribed medications without consulting your doctor. Instead, request a full medication review and ask about safer alternatives. Your brain is invaluable, and protecting it should be central to every healthcare decision. If you found this video helpful, subscribe for more evidence-based health information. Share your thoughts and experiences in the comments, we love hearing from you. Thanks for watching. Music,